Morning. Today's guest has walked an extraordinary path through healthcare leadership. From his early days working on a community healthcare project in China, to shaping health policy and leading system responses to SARS at the Ontario Medical Association, to serving as executive director at York Community Services, and to leadership roles at ParaMed Home Healthcare, the Lynn and now CEO of Tri County Mennonite Homes, Stephen Harrison's career has been defined by purpose, resilience, and service.
Know the people around you, know what's important to them. Do those Myers-Briggs assessments or things like that and understand what makes someone tick.
Yeah.
Because we're all different.
He has guided organizations through crises like SARS and COVID-19, and today he's leading Tri County Mennonite Homes through an exciting redevelopment of long-term care that reimagines what the future of seniors living can be. You know, when you came into Tri County Mennonite, they were really struggling with staffing, and you are not really using agency anymore. So can you talk about how you and your team were able to turn that around and what that looked like?
2 years ago, we were almost 50% agency across our organization and drowning. We spent a lot of time really trying to digest and understand what's important to our teams.
In this conversation, we'll explore Stephen's incredible career journey, what it really takes to lead teams through crisis, and his vision for the future of long-term care. We'll also learn about the surprising lessons from his very first job and discover a personal detail most people do not know about him. This is a story of leadership, perseverance, and hope for the future of care. I'm Heather Maxwell, and I would love for you to join A Minute with Maxwell, Mission in Motion. Stephen, welcome. We're so excited to have you with us today.
Thanks so much, Heather. Great to be here.
Stephen, you had such a fascinating journey from working on a community healthcare project in China, as I mentioned, to shaping health policy responses to SARS at the Ontario Medical Association, to your leadership roles across community services, home care, and now as CEO of Tri County Mennonite Homes. Looking back, what drew you into healthcare in the first place? And how did those early years working in China shape your perspective on community health and influence your leadership style today?
Well, what drew me into healthcare originally was a long time ago. People will say this, when I was a kid, I wanted to be a fireman or something like that. I actually didn't want to be in healthcare as a child, but I grew up in an environment where I grew up in the Caribbean, and at the time there were a lot of newly developing and emerging countries. So I grew up in Barbados, and I was surrounded by folks from the FAO and the WHO in our area, but also who were there stationed to help build the country's infrastructure. And so I didn't see healthcare as my sort of journey into support. I saw myself, as you mentioned earlier, being part of a larger service model. Healthcare just happened to be something that I was drawn to, I think, personally and with passion as time went on. But certainly those early years, I watched people come along, and my father was part of a CETA project from Canada as well, building infrastructure, schools and roads and education facilities, higher education facilities, common infrastructure in a country, sewage treatment plants, things like that. And through that, I recognized that there was an opportunity to support the development of a community, and community with a very big C at the front. It can be your local community where you live. It can be a nation. It can be a region within the planet. And so I started there with the concept of service and community. And then from there, over years, grew into the notion of healthcare being the place where I would fit well. And it was very much healthcare as a community sport, not just acute care or long-term care or anything like that, but very broadly health and support for the well-being of a community. Fast forward a little bit in life, in my late teens and early 20s, I ended up with an opportunity to go and work in Southeast Asia. Opportunity is a funny word. It was more a deliberate opportunity I took. I went on a education opportunity to China, not one that was really crafted by anybody, but one that we created on our own to go out, and myself and a couple other folks to go out and explore a little bit and see what opportunity looked like in China and Southeast Asia. I was bored. I was a person who had lived around the world a fair bit and came back to Toronto for school and wasn't really feeling it. So getting out there and going out to other parts of the world made sense. One thing led to another, as they always do in life. And before I knew it, I was doing some research work there and working with various members of local commune as well as provincial governments in a rural community, trying to help to understand social determinants of health and decision making that went along with that. But more importantly, how to help communities to grow. And China was not the industrial machine that it is today. This was prior to it really kicking off. So rural communities were truly rural when it came to connectivity, but population size, a rural province of, I don't know, about 20 million people at the time, almost half the population of Canada today, living in a space about half the size of Ontario, and still deemed to be a rural area.
Wow.
And so spent my time there, loved it. But what did it teach me about healthcare and where I wanted to position myself? It taught me that in order to be a strong leader or to grow in a community and support a community, there are a couple key pieces that you need to have in place. One is resilience. You can't be afraid either, although it teaches you a healthy dose of fear when it comes down to things. You can't be too brave, but you have to be brave enough to realize when you're in a good spot to keep moving and in a good spot to stop and reflect and build that personal resilience and grow with the changing times around you.
That is amazing. I love that. And I have to say that you are definitely one of the leaders in our sector that is all about community, right? And I've seen personally firsthand how you have built those relationships within your community now at Tri County Mennonite Home. It's actually beautiful to see. And I just kind of want to mention that when you first, we actually recruited you to this role at Tri County Mennonite Long-Term Care. And I did say to you, I think we met about 15 years ago, and I did, and I think you were in community care at that time, if I'm not mistaken. And I think I said to you at one time, I'm going to get you into long-term care. I think you need to be in long-term care, and I think you laughed at me, actually.
We did have a good chuckle about that. I remember that conversation very well.
I think
Yes.
so. I think so. And that was like 15 years ago. I'm sure I said that to you, and you just kind of laughed at me at the time.
But here I am today, right?
Here you
and
are
it was
today. Yeah.
I always believed actually, even then when I laughed about it, I always believed that seniors care, elder care, geriatrics were the way forward. I mean, demographics, we could see what was coming, not only in Ontario, but across the planet. 30 years ago, 40 years ago, we saw what would be occurring. There wasn't a lot of appetite at the time, either academically or certainly politically, to address what we knew would be the coming challenge.
Yes.
And where we find ourselves today. And so at the time, when you're plotting your future and you're looking at your career, it seemed like the wrong place to be sitting because there wasn't any interest in the conversation at the time.
Yes.
Fast forward to the last 5 to 10 years, and everyone woke up and went, oh dear, we're going to have a problem. And so I took the opportunity to build my experience and understanding of healthcare across the spectrum in those previous years, and hopefully, and trying to make some positive influence and change today by bringing all of that experience to what is today's new crisis, right?
Stephen, I just want to talk about you personally for a moment. And I like to ask people, how old were you when you first started working? And what did your first job teach you that still applies to your leadership today?
How old was I first started working? Oh dear. That's a long time ago, Heather. The world was flat. The world was flat back then. I started doing my first, like anyone else back in the day, I think as a kid, I started out with the traditional grass cutting and car washing sort of services to our local community. I was probably all of 10 when I started doing that.
Yeah.
Cash was king, right? People would pay you $5 or $10 in cash, and you rolled it up, put it in your pocket, and went and knocked on the next door.
Yeah.
And so it was less about the money for me at the time, and it was more about the activity of being productive, I guess. I don't know how else to explain it. I mean, the money was always nice. It gave you freedom, but
Yes.
certainly it was the opportunity to go out and kind of spread your wings and create that little bit of independence, right?
Yeah. Yeah.
My first job when I had a social insurance number was working in the store at the main gate at Canada's Wonderland, if you
Oh,
can believe it.
wow. I didn't know that. That's so
I
interesting.
That
Wow.
was my very first job. I
Wow.
was
Amazing.
worked at stocking shelves in the main gate store at Canada's
Wow.
Wonderland for a summer. It was the worst job I've ever had in
Was
my
it the
life. I
worst
have
job?
to admit it. It was a terrible
Oh,
job,
oh
but
no.
I got to see the Grateful Dead when I was there, and
Oh,
Rick
cute.
Astley was there. So I mean,
Oh,
like
good.
there were some perks to the job,
Some
but
perks. Yeah, some
it was an
perks.
awful job. It was an awful job. But
Oh,
one of the very first jobs I had that kind of fit into the trajectory I took in my overarching career, though, is I was a community based home care worker, PSW, before they were such a thing.
yeah.
Working out in the community out in Scarborough, actually. I used to support a couple families with complex clinical needs for their loved ones, and would go in the mornings and get people up and ready to go for the day, and return in the evenings and do the same routine. It worked well. I was in university and fell outside of my traditional class hours. And so, it kept me busy, but it really gave me an appreciation for where I am today, but certainly through my career, gave me an appreciation for how tough it is to support someone with complex medical needs on their good days,
Yeah.
let alone when they're having a bad day.
Yeah.
And so when I read the reports of our staff who are like, I just got frustrated and I just needed a moment, I can relate. I get it. I
Yeah.
remember those days where, you got up at 5 a.m. and came out in a snowstorm to help someone who
Yeah.
just rolled over and looked at you and said, piss off. I don't want to see you today, sort of
Yeah.
thing. And
That's right.
it's, it's a matter of finding that sweet spot in the middle, but it gave me a truly an appreciation for how hard that work is, but it also gave me a drive and a desire, I guess, through my academic pursuits and then into my career to be part of trying to make the system of care a little bit better. I mean, in my own tiny little way, if I can contribute somehow, I'm happy to be doing that.
Yes, that's amazing. You mentioned about the staffing challenges, and of course, that is near and dear to my heart in working in people and culture. And it's so interesting because for the first time in our history and really around the world, we have more people over 65 than we do the younger generation. So the demographics are very much changing, as you said, and we will be feeling the effects of this for the next few years for sure. And so, can you just talk a little bit about when you came into Tri County Mennonite, they were really struggling with staffing, and there was a high use of agency as well. And I know you and I talked a lot about that at the time. And now you have completely under your leadership, you and your team have really turned that around, and you have become an employer of choice that attracts staff to your organization, and you are not really using agency anymore. So can you talk about how you and your team were able to turn that around and what that looked like?
2 years ago, roughly 2 years ago, we were almost 50% agency across our organization and drowning. It was financially untenable. You didn't know the staff who were in the hallway. And as you know, with agency staffing, it's not like you get the same person over and over again. You get whoever seems to be in the rinse cycle at the time. And so we had a lot of discontent amongst our staff, our leadership team, our families and residents. They didn't know who was caring for them or who they were going to be working with it on any given day. One thing leads to another. Sometimes stuff happens for a reason. We were partnered with a third party doing our support for HR. It was the middle of the pandemic. We were all pulled very thin. I could see it wasn't working, but the concept of actually making a change by my own decision didn't seem to fit. We had so many other priorities, and then you know, fate as fate may be. I got a phone call one random day saying, "Do you have 5 minutes for a phone call?" And I was given a 30-day execution of contract notice by our HR support saying, "Sorry, but we got to go." And I hung up the phone and I stood in a cold parking lot on the side of the 401 for 5 or 10 minutes, fuming, and then realized that, being angry was not the solution. So we went out and recruited our first of what are now three HR professionals to join our team.
Yeah.
And the mandate was very clear. We had low retention, poor recruitment, too much agency, everything else. I said, I would like to say the sky's the limit, but I can't. We're a not-for-profit after all, but I need a solution put in place. And sometimes you just get really lucky. Through your recruitment process, we found a very competent HR lead to start things. And I would call them an HR strategist as opposed to an HR person writ large or by general definition. And they and the team have deployed a strategy to recruit. And at the time, we were recruiting for every 7 to 8 people we would actually offer a job to, one would stay.
Yeah.
And that was also part of the dynamic we were seeing in the HR world at the time. I'm sure you saw that too. People would ghost you. They would say, oh, I'm really interested in a job. And then they never call you back.
Yeah.
We saw a lot of that. So we needed to hire, 250, 300 staff in short order. We went through 2,000 to 3,000 people to get down to those 250 who ended up staying. But as soon as we started to see the shift happen, took a good year or so, where we were actually able to recruit people and get them to stay, we pivoted a bunch of our attention to retention as well. There is not a one size that fits all for a human being on this planet ever, from shoe size to shirt size to HR requirements. And we spent a lot of time really trying to digest and understand what's important to our teams. We can't be everything to everyone, but certainly where we can make flex and fit work better, whether it's accommodation around scheduling. Some people only want to work a condensed work week, 4 days. They want to do a full-time job because the other 3 days they have family commitments or something else they want to do, another job, whatever it may be. We flexed around that a fair bit. And so fast forward to today, we have fully staffed our organization. We have no agency.
That's great.
It is. And we actually have folks who are asking us when the next full-time job will be available, who are casual or part-time with us. So
Amazing.
This is unheard of in 50 years of an organization being in business. This is the first time we've been in this place. We're not resting on our laurels with this whatsoever.
Yeah.
We are continuing down the road of actively listening and trying to adapt to changing times. And it's going to make changes for us too. We have to change. Our average age of our staff complement has dropped by almost 20 years. So we went from staff who were in their late 40s on average, we're down into our late 20s, mid 20s. And so with that comes, of course, a whole other gamut of things that you have to deal with. You've got folks who are getting married and starting families and, starting with mortgages and car payments and stuff. And we were, prior to the pandemic, we were dealing with a cohort of staff who were predominantly on the other end of that conversation. And so we're adapting ourselves internally around how we support our teams so that they want to stay with us. And we want them to stay with us for a whole bunch of reasons, but also because as you build a community of staffing to support the needs of your residents in their home, you want to make sure that you treat them with the same respect that you'd want to be treated yourself. And so that is very much the approach that we're taking.
Yeah, that's amazing. I just love that. And that speaks to your mission, vision, and values, right? Because people want to be a part of something that is meaningful to them, right? And that's why they stay really at the end of the day when it is meaningful work. And that's what you have created at Tri County Mennonite. So kudos to you, because I know that that was no small feat. And when I know what that's like to have to reach out to 3,000 people to hire about 200, right? It's a ton of work. And then to retain those people that you do hire, it is a ton of work. So kudos to you, Stephen, and your team.
I can take very little credit for that other than turning up and kind of encouraging forward on the tough days. Really, there was a team, and it included our DOCs and our administrators, everybody. To stand and deliver, right? Late nights doing interviews, weekends reviewing resumes, tough conversations about why this person, not that person.
Yeah. This podcast is brought to you by Maxwell Management Group. For nearly 2 decades, we've worked side by side with individuals, teams, and organizations to uncover what makes them exceptional and to help them grow from the inside out. It's not just about reaching goals, it's about creating success that feels deeply authentic and genuinely meaningful. Organizations like people have stories, and when those stories are rooted in purpose, they become powerful forces for attraction, culture, and identity. We are committed to partnering with brands that want to lead with intention, cultivate vibrant workplace cultures, and become the kind of employer that top talent seeks out, not because of perks, but because of purpose. Over the past 18 years, I've had the privilege of leading Maxwell Management Group's growth into a highly specialized national executive search and education firm, one that thrives on values, vision, and the belief that when people lead with purpose, extraordinary things happen. To find out more about our executive search, recruitment, and education services, please visit us at maxwellmanagementgroup.com. And also, I have to say, Stephen, you're very humble in what you just said. But at the end of the day, we know Gallup actually just came out with a study and a survey that said there is 50% less voluntary turnover if you are in a coaching culture, rather, right? So if you have a coaching culture, you will experience 50% less voluntary turnover, which is huge, as we know, especially in healthcare. That is huge. And you are a coach. You mentioned sports teams, and having the right coach, as we know, is everything, right? It means the difference between winning and losing at the end of the day in sports. And it also is true in healthcare, though. Do you not think, Stephen, as far as having a coaching culture, what would you say that you've done to promote a coaching culture in your organization?
I think there's been a couple of pieces. One, we created better transparency around everything from budgets to turnover information. I mean, all of that. It's very difficult to lead when you actually can't see what you're supposed to be leading, right? You can't lead in the dark, basically. And so we created a lot of new tools. And people will say, "Oh, it's another tool in my toolbox that I have to carry around with me," and they're not wrong. But I listened, and the complaints or the concerns we heard is, there is a lack of transparency, or I don't have a clear line of sight in a timely fashion on things like budget, gaps in master lines, people's retirement plans, things like that. And it made it hard for leaders to plan. You're fixed in the moment, not being strategic long term. And what we want is our leaders to be much more strategic, and our managers to manage the day-to-day operations. And as we've tried to tier out the organizational structure a little better and put people in strategic roles who can have strategic vision, and put people in management roles who can manage day-to-day operations, we had to create the tools for each one of those tiers to actually survive and thrive as well. And so we built a lot of tools. We, as best as possible, try to create an environment where we get together as a team and have regular meetings. That they're always so hard to do with everyone's schedules. But I always tell my team, if you need me, the phone is always on, and that's not a figure of speech. It is a literal statement. And so if you need to call because you're up at 10 o'clock at night and something's not sitting with you, just pick up the phone and call.
Yeah.
And on the other side of that, I got to know my team quite well, not only through SARS or COVID, but since then. And I have team members who do their best work between 9 p.m. and 3 a.m. And I have those who do their best work between 3 a.m. and 9 a.m.
Yeah.
And you got to kind of meet them where they are as well, right? So if they need a conversation to happen at 6 a.m, because that's when they're at their prime and they've had time to think about something and they need to get their day started that way, you have to be available for that. And the flip side is, if someone needs to wrap up their day and then have a conversation about how that's gone and plan for their next day later in the evening, you work towards that. And before I can hear people down the road putting comments into some chat box somewhere going, you need to take care of yourself. And you're not wrong. And it's also leader, know thyself and what's important to you to take a break, right? And when.
Yeah.
And so everyone functions differently. I have colleagues who tell me if I don't get 10 hours of sleep, I'm no good to anybody. That's their way.
Yeah.
Um, Others of us need to read a book for an hour or watch, a friend's marathon at 11 o'clock at night because that's what settles our brain or gives us something to laugh about. It
Yeah.
doesn't really matter, but know yourself well enough to know where your spot is and be ready for that. And you do have to take care of yourself. No one's going to do it for you. So spend that time. But I also believe in the concept, and there's a book out on this called Leaders Eat Last. And
Yeah.
sometimes you have to put yourself up front to help others before you worry about sitting down for a meal at the end of the day. That can be literal or figurative, but certainly you sometimes have to do that. And that's, to me, that's what gets me up every day to get moving, is that opportunity to help the team, which by extension gets our community into a better spot and helps us be a better part of the overall healthcare system.
Absolutely. And so you've been through two major public health crises, and that's SARS and COVID. Do you foresee another pandemic in our lifetime? And if so, how can leaders and organizations prepare differently this time?
Oh, I have no doubt that something else is going to pop up somewhere along the line. Population growth, population density issues, lack of clean water, environmental changes, all these other things. We're creating the perfect petri dish for some other form of healthcare crisis to come along.
Yeah.
It may not be something as I'll use this word gingerly, simple as an infectious disease. It could be something far more elaborate. It could be something that has a longer lag period before we notice it, or a higher latency in the population. Who knows? But I think, yes, something will come along. Preparation. I was talking to colleague's daughter who's thinking about going into healthcare. I didn't tell them not to. I told them that it was a great career choice. But she said to me, what is the one thing that you would do that they wouldn't teach you to do in school? And I said, the one thing that I always tell people to do is read, and read broadly.
Yes.
So, don't take because you read a journal article or a TikTok video popped up on your screen or something. Don't take that as the gospel truth. If it interests you, go and look.
Yeah.
And read everything from the Wall Street Journal all the way through to Maclean's. Read the Toronto Star just as well as you would read the Globe and Mail. Don't get fixated. We are manipulated heavily by media and by what is desired for us to know or not know.
Yeah.
And so don't be afraid to drop down the rabbit hole a little bit and take a look into things a little more deeply. It builds kind of cognitive resilience. It builds an academic desire to pursue further.
Yeah.
And when I went through university and ran the gamut all the way through and doing my doctorate and everything, someone asked me at the very end, they said, so now that you've learned all this new stuff, what do you think you're going to do? I said, I have no idea, because I'm not sure I learned anything new. I learned how to learn.
Yes. Yes.
And I think that's the most important part. Embrace the pursuit of learning something and then continue to learn. You should never roll back on your heels and say, I've got my degree, I'm good to go.
Yes.
The moment you stop opening a book and reading something is the minute that you stop actually having valuable sort of content to bring to the table for folks. So really embrace learning.
Absolutely. I think you and I both agree that we are lifelong learners, right? I always say I learn something new every day, especially in healthcare. There is so much to know and so much to learn, and things are ever evolving as well, right? So I agree with you. I think it's important to read every single day, and I just think that's such good advice to just be a lifelong learner. And so
Absolutely.
Stephen, what other advice besides the, always be a learner and reading, what other advice would you give to emerging leaders in healthcare who may one day find themselves steering teams through crisis?
For myself, having been through a couple of different hiccups along the way here, know your team around you as best as you can. Teams change, but know the people around you, know what's important to them, whether it's family, pets, food choices, whatever it is. And it's not to use that as a tool, but it's to understand the human being.
Yeah.
Do those Myers-Briggs assessments or things like that and understand what makes someone tick.
Yeah.
Because we're all different. And despite what people may say about me from time to time, whenever I do these personality profiles and stuff like that, I always come up as an introvert. And
Ah,
everyone laughs. Everyone laughs when I say that to them.
yeah.
And the reality is, I spend a lot of time in the car going from place to place, meeting to meeting, stuff like that. And it is that moment in time when I'm in the car where I get to be my introverted self. And whether it's loud music or dead silence and the hum of the tires on the road, it doesn't really matter. Know what makes yourself and others tick,
Yeah.
and make sure to create the space for them to have the benefit of being able to do whatever that may be for them.
Yeah.
I think that's important. The other side of things is off the top of your head, you better know the core risks and the core opportunities that exist in your business line, whatever that may be.
Yeah.
It doesn't have to be perfect. It doesn't have to be spot on to the nickel if you're looking at budgets, but you better know your organization well.
Yeah.
Because in a moment of absolute crisis, when things go off the rails in a hurry, much like we experienced with COVID, all of a sudden we woke up one day and the world had pivoted quite dramatically. I think the other thing, it has always served me well. Don't be a follower sometimes.
Yeah.
Stand up, and if you've read 20 things and you're reading a directive that's been put in front of you, and everything else you've read says that that's not the right direction to go, don't follow blindly. Raise your hand and ask a question. And if you're told just accept it at face value, don't.
Mm-hmm.
We closed as an organization at the beginning of the COVID pandemic. We locked our buildings up and pivoted how we admitted family members and community supports in and out of the building almost 3 weeks before the province told us to do it.
Wow.
And I attribute that decision, despite taking a beating in the media, the local
Yes.
media over this, I attribute that to the fact that we had next to no catastrophic impact from COVID in the early days in wave one.
Amazing.
We were not the fan favorite with everybody, but we made a determined decision to do things. We masked long before we were told. We made mandatory masking requirement. We did a whole bunch of things that were weeks, sometimes several weeks in advance of getting provincial directive.
Yeah.
But it's what made sense clinically, and we just got on with the day.
Yeah, wow. That was great foresight, Stephen. And sometimes, like you said, you just have to make unpopular decisions, but based on your experience and the data that you have, right? So, yeah, that's amazing. And so,
Yeah,
Stephen,
we were proud of our outcomes with that for sure.
yes, that's amazing, amazing. So, as we wrap up, Stephen, when you think about your legacy, both in healthcare and in leadership, what do you hope people will say about the impact that you've made?
He never settled for what was in front of him, and mediocre is never good enough.
Yeah.
I'm hoping that they will at least remember that part about me. I
Yes.
do not believe that we should just settle for the status quo on pretty much anything. And mostly because the concept of the status quo is that that's the average of what we do today.
Yeah.
And the average is never good enough. We should be
Yes.
aspiring for better.
Yes.
So take a look at what you have in front of you. And if it is working, great. Don't just toss it away, but find a way to innovate or improve.
Yeah.
Because I think that is the most important part. That is what, for me in leadership, is my inspiration, is how do I make it better for tomorrow? Because
Yes.
the person behind me who comes in is going to try and build off of that. So it is the stability around that risk-taking adventure as well that I think is important. Calculated risks are important, but stability in taking those risks is critical as well. And
Yeah.
build with an eye that, 20 years down the road, I want someone to look at it and not scratch their head and say, what was that clown
Yeah.
thinking? Instead, I want them to say, wow, he was progressive in his thoughts. And I can
Right.
kind of get an idea on where things were going in his head. That's kind of my goal.
Yes. Yes. Well, thank you so much, Stephen. I so appreciate you being here with us today. And thank you so much for sharing your journey with us from those formative early years in China to shaping health policy during SARS to leading through the challenges of COVID and now envisioning a brighter future for long-term care through redevelopment at Tri County Mennonite Homes. Your story is a powerful reminder that leadership is about courage, clarity, and compassion, especially in times of uncertainty. We've learned so much about what it takes to guide teams through crisis, how resilience is built step by step, and why the future of long-term care is more than just about buildings. It's about creating communities of belonging. To our listeners, if Stephen's journey inspired you, we encourage you to reflect on your own leadership path and what lessons from your past are shaping the future that you want to build. Stephen, thank you again for joining us, and to everyone listening, until next time, keep leading with purpose and let's keep these conversations going.
Absolutely. Thank you so much, Heather.
So thank you for joining us today. And if you would like to learn more about how Maxwell Management Group is supporting the continuing care sector, please feel free to visit our website at maxwellmanagementgroup.com. And also, please like and subscribe to our podcast wherever you download podcasts. Thank you for joining, and see you next time.